Hello, my name is Dr. Craig Forleiter. I'm a board-certified plastic surgeon in Palm Beach Gardens, Florida, and I'm so honored to be sitting here with my patient. Can you tell me a little bit about how you found our practice?
Sure. So I actually got my initial reconstruction done in North Carolina, and I was looking to establish with the practice when I moved to Florida, and my oncologist recommended you all.
A lot of times when a patient is diagnosed with breast cancer, they meet us from the beginning, but your story is a little more unique in that you actually met me after your surgery had already been completed. It was obviously an honor that you were referred by your oncologist, and I was happy to provide your surveillance, but I didn't really need to do much at that point other than surveil. What is it that established our rapport and that enabled us to move on to other surgeries?
I'm so glad you said that, because one of the things that I initially really loved about you was that you didn't pressure me into doing anything. I felt like you did a great analysis of my current condition, what my surgeon did, and then said, here are your options. And I didn't feel any pressure. I didn't feel like I needed to do something just because I was establishing with the practice. And I think you even said to me something like, I hope I don't need to do anything, right? And I really appreciated that. It was very empowering and felt like it gave me a choice in how I wanted to go forward.
I think that's so important. It's what I try to do in every patient interaction is empower the patient. They're in the driver's seat. I'm there to guide. I'm there to coach. But so many times surgery is not necessary, but as we got to know each other, there started some other things that were bothering you that you felt comfortable talking to me about. And so many of our patients begin seeing us for one reason and then become our patients for different reasons. So let's talk a little bit about that.
Sure. Yes, so my left side, I had radiation on my left side after my mastectomy and reconstruction. And I started to notice a lot of tightness on that side, and it was getting uncomfortable and painful. So I came in a couple times for that, and we were keeping an eye on the situation. And then a few months into last year, I realized I was having more pain, and that's when I came in to consider some adjustments to my reconstruction as well as a tummy tuck. That was something that I wanted to do for myself. And as I got to know you and how you interacted with your patients, but also how you interacted with your staff, I really felt comfortable and confident that you were the right person to do these surgeries, to do the reconstruction and the tummy tuck. And I was really excited to do that with you.
So thank you for saying that. Obviously, a patient feeling comfortable with their surgeon and a patient feeling comfortable in the practice is a very important thing. The culture that we try to espouse here is one of patient empowerment, but also the way we treat each other. And the fact that you picked up on that, it shows that you were looking for the right things in a practice. I think that doing a revision to the breast reconstruction is a big decision, and I was so happy that we were able to do a great job with that. But at the same time, being able to work on something that's been bothering you for a long time and do that tummy tuck or that abdominoplasty, why not? It's something that you were clearly concerned about, something that was bothering you, and the fact that you felt open and comfortable to talk about it, I was happy to listen and I was happy to provide recommendations. One of the things that struck me about you as a patient, especially having undergone bilateral mastectomy and reconstruction, is you never lost your confidence, you never lost your self-love. It's an absolutely beautiful thing, and it's something that we strive to give patients back after these diagnoses. It was so powerful to watch you go through that reconstruction and see that it never got you down. It made you stronger, and our female patients that have gone through this are warriors. Our proudest accomplishments are helping patients like you. When we discuss mommy makeovers, that's usually the combination of a breast procedure and a tummy procedure. So in your case, the breast procedure was helping that left side, that tight radiated left implant, but also removing some of the excess skin and soft tissue from your abdomen. Can you talk a little bit about what that meant to you?
Yes. So the breast procedure was more of a medical thing to relieve my pain on my left side, as well as even out my breast. My initial surgeon did an awesome job. I did have some, unevenness, so that was bothering me a bit. The tummy tuck was something that I'd been thinking about for a really long time, and I had gone back and forth between wanting one, not wanting one, and it was really important for me to have that come from a place of not feeling any kind of shame or discomfort with my body, but instead loving my body and wanting to feel even better about my body and my self-confidence. And so once I reached that phase in my journey, I was ready to do the tummy tuck. And that really has been such a great experience. It was awesome to feel like I could come in whenever I needed you to look at something or even send a text to the office. That was great when I was out of town and needed some help. And I really felt like the procedure went really smoothly. And for me, it just gives me an extra boost of confidence. It makes me feel a little bit better in a bikini, and it makes me feel stronger, like I can work on my abdominal muscles more, knowing that they're repaired versus separated. And so it really boosts my confidence, but also makes me feel stronger and look forward to getting even stronger now that my abdominals are repaired.
I think that people often don't realize that it's not just an anatomical thing, it's also a physiologic thing. When we do a abdominoplasty or a tummy tuck, we're not just removing the excess skin, we're not just resetting the belly button, but we're also tightening those rectus muscles, those six-pack muscles. And when those muscles are spread or loose, it's uncomfortable. It's uncomfortable to work out, and someone could diet and exercise until they turn colors. You're never going to restore that anatomy unless it's surgically corrected. So you said that extremely eloquently, and it's something that I hope other people that may be having similar complaints or concerns hear and realize, wow, there's a solution to some of this stuff. I think helping people look and feel like the best version of themselves is the coolest thing that we do. And I think that you were a strong warrior before, and to hear you say that this made you even more confident, it's the creme de la creme for me as a plastic surgeon.
Yeah, it really has helped my confidence. And I mean, even at my thinnest, I still had issues with my stomach, and throughout medical menopause and having 2 kids and just the whole journey, it really was something that I felt like regardless of how much I worked out, it wasn't about my weight, it was about the extra skin that I had. So being able to take that off and feel stronger and more confident was really important, and it's been great.
You're absolutely right that the best time to do an abdominoplasty or a tummy tuck is when you've lost the weight, when you've done the exercise, when you've done the diet, and you had some real medical hurdles counting against you, like being put into early menopause by chemotherapy drugs. So clearly you had done everything you could conceivably do. The excess skin, the safest, best time to do that procedure is when we did it. And so for you to say you never felt pressured and you got to the destination when it was perfect for you, that's a testament to you, your patience, your hard work, and hopefully to us not being overly pushy and just wanting you to get the best possible care and the safest possible care. We find that patients get the best results, the safest results when you do the work that you're supposed to do and we do the work that we're supposed to do. So you're a phenomenal patient, and you've demonstrated how important it is for us to have that working doctor-patient relationship, because we're both in this together, and the best results come from that sort of collaboration.
Absolutely. That's a critical piece, and I feel that truly versus just kind of some kind of philosophy that, okay, yes, we're partners, but are we really? I felt truly with this office that I was empowered and I wasn't pressured to make any decisions that I didn't want to make or need surgery when I might not need it. And that is critical. And I hope that other potential patients can hear that and know that this truly is a place where you are empowered, not just where they say you are empowered. And that is so important.
Talk the talk, walk the walk.
Exactly.
I think that we try to lead by example in that regard. I think that we have countless testimonials of people that would say the same, but it means the world to me that here you are saying it, loud and proud. It means so much to me that you chose us, our practice, and that you chose me to help see you through the rest of that journey. You were an absolutely stellar patient from start to finish, and I just want to thank you for being part of it.
Well, thank you, Dr. Forleiter, for your practice, for your skills, and thank you to your whole team for really changing my life and helping with my confidence.